Hello, I'm Dr. Vinay D. I'm the infectious disease consultant at Apollo Hospitals, Bangalore. This is a health awareness talk about coronavirus preparedness and prevention, which is mainly being done for Sudarshan Vidya Mandir in accordance with Apollo Shine Foundation, and the entire venture is supported by the Apollo Hospital Group. What I would like to inform you about the coronavirus is, it is, like the name mentions, a virus which can spread from person to person, mainly by coughing, sneezing, or by coming in contact with anything which comes out of cough or sneeze when a person is around you. What you need to know is, this coronavirus is as infective as any other common cold virus, and it can spread from an infected person to a non-infected person when you come in close contact with someone infected. What do you mean by a close contact? If a person is standing at a distance of 3 feet from you, and if he is infected and then coughs, the droplets which are carried in the air, you can inhale them and may get infected. Please remember this word, I said may get infected. It doesn't mean anybody who comes in contact with an infected person will always carry the infection. It all depends on your immunity. So if there is an infected person and he's in close contact, even though the sneeze or cough might occur, there is about 50% of chance that the infection may spread from person to person. At this point of time, depending on whatever data we have from China and surrounding countries, what we know is, it is an infective process, but not everybody gets infected. Your immunity will take care of your health as well. So what you need to understand, what you need to do to prevent coronavirus. Number one, coronavirus at this point of time, the number of cases are very less in India. Even though the current news which happened very recently showed that a person from Bangalore was infected, but he was mainly traveling from different countries and then reached India. So the virus originating from India still has not happened. Bulk of cases are in and around China, Singapore, Iran and Italy. So if any of your friends or family members have traveled to these places and places including Singapore and Hong Kong, have come back within the last 14 days, have some symptoms which includes fever, cough, runny nose or sore throat, ideally stay away from such people. You should advise them to take help at government center in Victoria Hospital, where they can get tested whether or not they have coronavirus. Anybody who's not traveled abroad, anybody who's not come in contact with any infected person, the chance of them carrying coronavirus is close to zero. So please avoid unnecessary panic. Anybody who has a cough and cold, fever without any travel will not be carrying this virus, and you're not at risk of developing this infection at all. Now, for example, you may not know a person where he has traveled, but he may be having some symptoms. So how do you avoid it? First and foremost, like I said, please avoid crowds. If you go to a place where you're not aware of, please avoid long distance travel. Do not come in contact with anybody who's having cough, cold, or you think is sick. Maintain a distance of at least 3 feet. Don't wear masks. Masks are not going to prevent infection in a healthy person. Masks are only for people who are really infected. They have to wear a mask to prevent spread of infection to others. So one, like I said, maintain a distance of at least 3 feet. Avoid touch, that is, greeting by namaste or hi would be more favorable than giving a handshake. So maintain a safe distance of at least 3 feet from these individuals. Do not touch anything unnecessarily, because somebody coughs, the spit falls on a table or some chair, you might touch it. The virus will last there for about 12 to 24 hours. Then you might get your hand close to your face, your nose or your eyes. Then there is a chance of you getting infected. So what you can best do is avoid unnecessary touching of surfaces, avoid unnecessary getting close to your mouth, avoid frequent touching of your face, nose or mouth as such. Carry a good hand sanitizer. Any hand sanitizer available in the market is good enough, but make sure it has at least 70% alcohol content. That hand sanitizer would be of great help. If you touch something unnecessarily or come in contact with a person whom you think is sick, more than the mask, what helps is a hand sanitizer. Apply a liberal amount on your hand, wash them well, allow for a 30 seconds contact time and allow for the hand sanitizer to be dry. Remember, at this point of time, coronavirus does not have any treatment. Even if somebody gets coronavirus, the chances of them recovering are 99%. So do not panic, do not fall prey to all the messages which are circulating in the social media. Try and prevent. Yes, prevention is the best cure at this point of time. Like I said, to summarize, maintain safe distance, avoid going into crowds, avoid going near anybody who is sick, particularly one who has fever, coughing or sneezing. Use good amount of hand sanitizer liberally without fail if you touch anything unnecessarily. Avoid frequent touching of your face, nose and mouth, and don't panic. At this point of time, till the direction is given, please avoid long distance travel till the government says it is safe. No treatment, but prevention is the best cure. Eat well, rest well, and have positive thoughts. That is the way to prevent coronavirus. Thank you.